Hi, everyone, and welcome. My name is Luke Severi, and it is my pleasure to welcome all of you today to our webinar on the marketplace for powering healthcare solutions. Today's webinar is part of a series of virtual events SEforALL is organizing. Last week, we organized a webinar with WHO and IRENA around key lessons learned from past and current interventions. Today, we are focusing on the solutions providers and their solutions that can help meet the energy needs of healthcare facilities in their COVID-19 response as well as beyond. Let's quickly run through today's agenda because we have a lot to go through. So I'll just go through a few opening remarks and some introductory slides. And after that, we'll have the bulk of today's presentations, where we have 8 very high level, high quality solutions providers who will be presenting their solutions, their powering healthcare solutions that range from containerized solutions to plug and play to energy efficient appliances, really a broad sample of the types of solutions that we're seeing in the market today. We'll then follow that up with the launch of a solutions catalog that builds on today's webinar, and that we will continue to update, and where we of course invite all of you as well to submit your solutions. We'll hear from an expert in the energy sector as well, to get some reflections, and then we'll close the webinar. But without losing too much time, I'd like to just move into the next slide, which is a slide that I assume that several of you have already attended a few of the past webinars, so this slide will be familiar to you, but I think it's a great slide to just kick this off, to really bring us to where are we coming from, what does this all mean, especially when we talk about powering healthcare, what is powering healthcare, and where does it fit? So we, of course, as SEforALL, we're approaching this starting from SDG 7, and we see that powering healthcare can really advance all 3 key targets under SDG 7, both on access, of course, when we talk about electrifying health facilities, both also on renewable energy, when we talk about how do we actually provide reliable power and sustainable power to these health facilities, and also the third target on energy efficiency, where we look at the appliance side, the demand side of powering health, and how can we make sure that the power that is needed, that it's actually allocated in the most efficient way. But of course, this is not acting, powering healthcare is not acting in a silo. It's not just acting within SDG 7. We're clearly also impacting many other of the SDGs. SDG 3, of course, is the most obvious one around good health, but also briefly want to highlight, in this case, SDG 5 on gender equality, because we know that when we look at the demographic, the audience, the catchment population of primary healthcare facilities, it tends to focus a lot around women, children, and of course the families. When we talk about maternal child health services that can be offered at these health facilities. Also not forgetting about SDG 13, when we talk about how do we implement these solutions as part of building a resilient health sector, and a health sector that is part of a green recovery, of a better recovery, both in terms of just generally how the health sector is needs to be further developed and work towards universal health coverage, but also as part of a response, a recovery from the current COVID-19 pandemic. Next slide, please. So we know that the data is very limited in terms of how big this problem is and where the problem is situated. But the data that we have clearly shows that the problem is big, the problem is real, and it needs to be addressed. It has to be a priority, both during this COVID-19 pandemic and beyond. I won't go into these separate statistics, but I want to show them also when we share the slides afterwards, that you have these to digest. Next slide, please. Briefly about SEforALL's Powering Healthcare initiative. So we have this Powering Healthcare initiative. We've had it for half a decade, and it stems out of the old SEforALL as a UN initiative. It has brought in many different partners along the years, and in its current iteration, we're focusing on these 6 activity pillars. So we just wanted to give a bit of a highlight in terms of how we're focusing powering healthcare in the next few years, and also what some of these upcoming activities are that you can look forward to. And I'll just highlight a few of these activities, maybe under the second pillar under thought leadership. Several of you have already been involved in a briefing note that we've developed around sustainable business models. We're now in the process of upgrading that into a more public-facing white paper that really focuses on the sustainability aspect of how do we electrify health facilities at scale, and also do it in a sustainable way to make sure that our interventions continue to have a lasting impact. Also want to highlight under number 4, of course, under collaboration and coordination, the work that we have been doing and continue to do in coordinating the sector, in trying to broker some introductions, some collaborations between different partners, public and private, or international and national. Different types of actors all have a role to play. This is also where this webinar in particular really falls into this category, where today we want to focus on powering healthcare solutions. We will follow this up as well towards the end of this webinar with an actual solutions catalog that will keep on being updated, that will keep on giving into this space. And perhaps also highlighting number 6 on country level advocacy and country level advisory. We are continuing to assist countries in developing comprehensive strategies that really look at how they can tackle powering healthcare, how they can tackle the electrification of health facilities, both at scale as well as in a sustainable way. So I just wanted to provide this as a bit of an overview slide. Let's move to the next slide, because that's one that I think several of you have seen as well. And I'm very happy to just keep on recycling these slides, because it's important that we just don't forget this. In the last, give or take 3-4 months, the number of articles, op-eds, opinion pieces, etc., that we've seen that link electricity, the importance of electricity to healthcare, especially in times of COVID, like we stopped counting, and we're trying to keep a repository on our website, but it's hard because there are so many, which is great, because it's really showing the importance of electricity for health facilities to help them combat the COVID-19 crisis. Yet that increased momentum and drive and interest has not really been translated yet into a lot of action on the ground. And we just wanted to list out what we see as being key barriers that are holding this back. Maybe let's move to the next slide, because I want to highlight these 3 barriers, because those are the ones that today's solutions are specifically focusing on. So the first one is around energy demand. We still don't really know enough about which appliances are available, which appliances have been developed, what is the difference between the reality on the ground and the theoretical recommendations that come out of like either the global health partners or ministries of health. Secondly, on system design, because we don't have that full grasp always at the micro level of the energy demand, it is hard to develop a system design that is also robust and that is more sustainable. How much power is needed? What is the load profile of these clinics? Like how do we make sure that we develop more sustainable solutions and that we use the appropriate technologies? Again, today we'll see a lot about these technologies. And then maybe the last one that I want to highlight is sector capacity, because that was, especially in the beginning, a big barrier where even if there's a lot of interest, because countries are on lockdown, because supply chains are interrupted, there's a clear limitation that the sector has to actually respond to this at scale and very rapidly. So today's interventions, today's solutions that we want to highlight have specifically been chosen because they can be rapidly deployed, because there is a certain level of inventory that is available, strategically placed in certain countries. And that is also where our solutions catalog wants to continue focusing on solutions that are appropriate and that can be rapidly deployed to really support these health facilities. Next slide, please. Great. That's it for me. I now have the pleasure to introduce 8 speakers. So I'll start with Anshul from d.light, who's going to kick us off. And just for the audience, just to make sure that everyone is aware, we are giving 8 solutions providers now. We're giving them approximately 5 minutes to present their solution to you in the form of a pitch. Yeah, I won't take up more time because I think we all just want to hear from the solutions provider. So let's move to the next slide, and then Anshul, if you can unmute yourself, and your 5 minutes start now.
Thanks, Luke. I am Anshul Gaur. I'm the director of grants at d.light Design. We are the largest distributed solar lantern and home system provider in the world. This year in Jan, we crossed over 100 million lives impacted since we started 12 years ago. Overall, our mission is to provide reliable energy to the 2 billion people in the developing world at the base of the pyramid who lack access to reliable energy. Next. Yeah, we can skip this, thanks. Look, as you were mentioning, the pandemic has had an adverse effect on these vulnerable communities that we serve. And it's not just in terms of the shrinking finances, but also in terms of the lack of reliable healthcare that they have access to. 1 of 4 healthcare facilities are off-grid today, especially at the primary healthcare level, which is what our customers and consumers access. These facilities are generally off-grid and difficult to reach, and especially in rural areas. Unfortunately, these are the same facilities that are also largely ignored today because of their remote location and the fact that there are over 51,000 of them spread across Africa, and hence have received little to no funding today. We feel that unlike tertiary and secondary healthcare, which are currently funded either by the government or by public-private donor partnerships, these smaller healthcare facilities, which comprise essentially health posts and clinics, don't really require a lot of power, and hence would even benefit from smaller plug-and-play home systems that a lot of the brands in our industry can provide, including d.light. So how do we bridge the gap? Next slide, please. So d.light essentially wants to fortify these vulnerable clinics and health posts with solar power. d.light's core fundamental is not just to provide access to electricity, but also to provide the means to utilize that electricity. Again, borrowing Luke from one of the points you made, that over 70% of appliances are currently either defunct or not functioning properly. So what d.light offers is essentially a bundle of our solar home system, which comprises provides all-night lighting for up to 5 rooms, has the power to run a DC medical refrigerator, offers multi-mobile charging, has a rechargeable radio bundled in for information access, which the government is currently using a lot to educate all these remotely located healthcare facilities. Besides that, we've also included our d.light smartphone, essentially because that has become the go-to digital device for communication between the central healthcare ministry and these facilities. What we feel is that through that, these facilities would be able to share electronic medical records, help with maternity care education, as well as training, of course, and keeping in mind COVID, they also have the capability of then doing contact tracing. Besides that, we offer, as a part of the bundle, a task light for any surgical operations that need to be done. Next. So the d.light solar bundle, sorry, could you go back? The d.light solar bundle, as I was mentioning, comprises these 3 products. We are offering the solar home system, the smartphone, and as I mentioned, the medical refrigeration part. During our research, we found that that was probably the biggest power draw on a healthcare facility, besides lighting. So what we've done is we've also included our own medical refrigerator as a part of it, and this has also gone through the Global Leap Award contest and has been declared a winner. So these three form the solar bundle that we are putting on offer. Now, what is the advantage of having a fully functional DC power system? If you could go next. Locally assembled per microgrid, thanks Luke. locally assembled microgrid power, they are offering the same kind of use case, but they're costing over $3,000. But d.light with its d.light appliances is able to do the same in less than $1,000. And the best part is that we are willing to do this in any of the 70 countries that we are operating in. And we could just go next. I would just close off, and these presentations are available for review, but essentially the three core principles is that d.light has a sustainable infrastructure that is available across 70 countries. We are providing appliances that not just provide power, but also connect patients to care. And finally, the best part is that we are able to rapidly deploy in less than 3 months. We have already started a 300 clinic electrification pilot in Kenya, which has been backed by FMO, and we're looking for more partners, especially around funding. Did I make time? Luke?
Absolutely perfect. Thanks so much. And you had the difficulty of kicking us off. But you said you raised the bar, and now it's up to the other your colleagues to meet it. Also, I see some of you have already started using the Q&A, which I really recommend, both for the attendees. Ask your questions, ask your targeted questions. Also make sure that you clearly highlight who the questions are for. Also for all of our panelists, speakers today, feel free to start answering questions if they're directed directly at you using the Q&A in Zoom. It's a nice way to have some two-way communication with the audience. Great, all right, happy to introduce now Thomas Rieger from Solar Kiosk. Thomas, I'm going to start counting down in 10 seconds. Please unmute yourself, and it's up to you now.
Fantastic. Thank you so much, Luke. It's a pleasure to be here.
Your webcam is kind of blocked at this point.
Okay, then I just stop the video maybe.
All right, great.
Good. So thank you for being here. It's fantastic, tremendous pleasure. I want to talk a little bit today about some things that you mentioned. And here with d.light and my other colleagues, I'm here as an expert of the renewable energy space. But as you said, we're hitting this Corona crisis, and we need to somehow figure out how renewable energy actually can be used to fight against Corona. From an energy demand or a system design, supply chain, I mean, many of the things that people should use in order to fight Corona are scarce and not available. And that's the first thing we faced. We have been doing solar power test labs, laboratories back in the days in refugee camps. And we have developed solutions that come along with the infrastructure and with the power to establish first level primary healthcare and test laboratory solutions in environments that are difficult to reach, and always with the keen eye on rapidity of setup. Can we go to the next slide, please? So we have done a two-prong approach, a little picture up there, where we go and cooperate with Ministry of Health and governments to implement a solution that can screen and then later that can test. Why testing is important in the Corona crisis is because now malaria season is coming up, the disease is spreading across the country, and nobody really knows who has been infected or not. The testing capacity is not up to par. And many governments these days are competing on releasing how many tests have been done, but it's very clear, and from what we learned in Germany, if you don't do rigorous testing all the time, it's difficult to cut the curve and to bring down the infections and the spread of infections. So this is what we did together with the United Nations. We have designed a two-ring approach, where in the first ring we would offer solar-powered solutions that help mobile teams that can move into communities to screen for patients that have been very likely infected with the virus. And in the second ring, we are offering solar powered test labs that can help to test patients and establish if a patient had caught Corona or not. In a third ring that we actually tackled last weeks, we are also tackling the issue of the ventilator, the mechanical breathing aids that will have patients that have been infected with renewable energy. So the suitcase itself has a couple of electrical appliances and our solar home system inside. So mobile teams that go into communities, rural healthcare workers, etc. They have the means to go in communities and measure a couple of vital signs. Thank you very much, Luc, to see if a patient might have likely been infected with corona. They are also online and connected. They always have their mobile phone charged in order to report back results and make transfers of patients to such test labs. If we go to the next page, we have designed a complete test lab that comes along with the building, with the infrastructure, with the solar power, and with the equipment, the virology test equipment that is needed in order to really securely test if patients have been infected. This is quite advantage because we can move with this test lab anywhere, regardless of infrastructure or electricity is available. We can build it quickly and rapidly up, and we can start testing at places where there is no electricity available. Currently, we're discussing a lot about vulnerable points of government and states, such as border crossings, internal airports, bus stations, marketplaces, schools, and so on and so forth. That's what the solution is being used for. After Corona is over, it should be reusable for testing malaria, HIV, hepatitis, typhoid, etc. And hopefully we can help by increasing the testing capacity of governments for the future, to also be prepared for upcoming other pandemics that might come in the near future. We all have seen signs of this one yet. So today we're looking for partners to join this. We're looking for interested governments, and we're also looking for finance solutions to make this available for governments in their fight against Corona. Thank you very much, Luc.
You had 1 second left, Thomas. I don't know if you want to use it to say something else. Absolutely perfect.
Thank you.
Thank you so much. Thank you for joining us. And I think it's already showing that we're clearly focusing on very different types of solutions that are all addressing different parts of this larger problem. So let's move along. And now happy to introduce Doye Ogionwo from Zola Electric. Doye, the floor is yours, and your 5 minutes start now.
Thank you. So hi, my name is Doye Ogionwo. I'm the Chief Commercial Officer of Zola Electric. Zola Electric is the leading solar brand in the markets that we serve, with over 1 million customers. We offer a full energy ladder that can solve any energy access problem, whether it be off-grid, weak grid, rural, peri-urban, urban, residential, or commercial. Next slide. Okay. So, but what I want to talk to you about today is our energy solution to support the COVID efforts in Africa. So, as we all know, and the two previous speakers mentioned, we have a significant number of reported cases on the continent, and those numbers are growing. We don't know what those are the reported numbers. We estimate that the actual numbers are actually higher, but part of the reason that we don't know what the real numbers are is that the healthcare facilities in those countries lack a number of things, including adequate energy access. And one of sorry, excuse me. So as I said, the existing healthcare facilities have inadequate energy access infrastructure, and under normal circumstances, prior to the pandemic, the infrastructure was already under pressure, and with the pandemic, that increases today. So, in a summary, I think reliable power is critical to power medical equipment and also to refrigerate medication and vaccine. And our solution that I'll talk about in a second is basically focused on providing reliable energy access to the primary care centers where to help moving on. So what are we doing? So Zola has partnered with Econet to provide a solution and deploy this solution in about 1,000 solutions in primary healthcare clinics in multiple countries in sub-Saharan Africa. The combination of our technology and Econet's operational expertise in these markets, we believe, is a strong partnership that would allow us to deploy this solution rapidly into these markets. Next slide. So let me talk about our solution. So our solution is based on our Infinity platform, which is our flagship product. Our Infinity is a smart AC power solution that manages all sources of power in the most effective and efficient way. So it manages solar, generator, and grid when that's available. Obviously, in the rural areas, that's not as available as we would like. But Infinity manages and optimizes all those sources of energy in the most efficient way possible and at the lowest cost to the end user. And Infinity also, and the reason why we call it Infinity, it's scalable. So you can add additional modules to grow the capacity. So it's flexible and it can adapt to the need of the clinic. It also includes remote monitoring. So we have the ability to monitor and manage the assets at all times, which obviously reduces the cost of maintaining the systems by not just the clinic, but also our partners in terms of how they manage the system. Now, what we are providing power for, the typical kit provides about 20 kilowatt of power and 50 kilowatt hours of energy storage, and can power not just equipment, but also refrigeration for vaccines and blood. And we're looking for, right now we're working with financing partners to raise financing to deploy these solutions in multiple markets. Thanks.
Thanks so much, Doye. That was that's just a third different type of solution, and I think it's after focusing on three solutions that focus a little bit more on the supply side, on the power generation side. Let's shift gears a bit. Let's shift our focus to the demand side, and let's hear what Gil at Ignite Medical Services has to say. Gil, your 5 minutes start now.
Awesome. Thank you, Luke and Jem. I don't know if you're here. I can't believe that for once in my life, I actually decided to play around and send just 2 slides. And I thought we'll have like a click by click, but never mind, we'll work the way it is. So thank you guys for having me and for organizing this amazing event. My name is Gil, and this is my absolute pleasure to introduce you to Ignite Medical Services today. So I want to start with the one thing that all of us have in common in this session, at least the majority of us, and I'm talking, of course, about the smartphone in our pocket. And the reason that I want to start with the smartphone, and you weren't supposed to see the entire slide at such an early stage, but never mind, is that if I would ask you to only address like the first sentence and to fill up the blank, where like smartphones is an amazing blank that disrupted our lives, most people will usually choose the word technology. Some others will choose product, while we see this as an enabling platform. And the reason that I decided to start with the smartphone is not just for showing my appreciation for the fact that you are not checking your emails right now in the smartphone, or at least I hope, but it's because this is the exact same way that we see the solar energy today. So if I'll ask you about solar PVs and to fill up the same sentence from the beginning, once again, most people will say that this is an amazing technology or an amazing product or maybe even solution, while we see solar energy today as a platform, as an enabling platform. Think of all the amazing achievements that described here before me, everything that the solar sector did in the past few years. What enabled the connection of so many people to power for the first time ever? So of course, solar panels had a very big contribution, and so are the advanced batteries. But one more truly incredible change was the LED lamps that are designated specifically to fit the solar panels. With very low energy needed and very low voltage, it was pretty much the first application on the solar energy platform. So in the last couple of years, we at Ignite Power, we worked hard to do anything we can to distribute this application and to provide as many people as possible with solar home systems. So to date, we connected more than 1.4 million people, produced more than 1 billion hours of light, saved more than 120,000 tons of GHG emission, and created more than 3,500 jobs opportunities. And now we feel like this is the time to take the solar-based impact to the next level and to expand the impact to the next challenge. And that is exactly what we do in Ignite Medical Services today. Next slide, please. Thank you. So in Ignite, in Medical Services, or IMS, we develop, adjust, and distribute advanced designed for solar medical technologies which reshape healthcare in rural communities. Today, we provide remote medical teams with two products. The first is the SDS16, which conducts a wide range of blood tests on the spot and allow for a very fast, smart, and a very affordable detection of a patient's condition. And the second is the one above, is the SDSX1, an energy-efficient X-ray diagnostic kit, which provides very high-quality imaging and diagnostic on the field, addressing COVID-19, TB, and a bunch of other health-related emergencies. So we have solar systems in place, and we have advanced technologies that were developed to fit those solar panels in place as well. But this is not enough. To provide remote teams with a holistic solutions, we learned that technology itself just not gonna cut it. And we have to provide them with a guidance and support at all times as well. So for that reason, we established a strategic collaboration with Spacecom, which is a leading operator of communication satellites, which enable a full online connectivity to all our clinics and health centers, no matter their locations at all times. Now that we have all the pieces in place, we feel very comfortable and ready to start running. And after a few successful pilots in different countries, we're actually officially launching operations today. So this is a very big day for us. 30 seconds, wow, thanks. And we will be very much grateful for any tip regarding funding opportunities, strategic investments, and any kind of relevant collaboration. Thank you very much.
Thanks so much, Gil, and congratulations on this big milestone today. That's very exciting. We're halfway, so it's been a first half of a very high quality, and I think the next 4 pitches know exactly what they need to do to keep this going. So yeah, I'm pleased to introduce John Key now from SolarAid. I'm curious to hear what John has to say. John, the floor is yours.
Thanks, Luke, and thanks for putting on the pressure there. Well, hello to everyone. It's a pleasure to be on this. I think we're a little bit different in terms of we're not a manufacturer. We are an NGO, and we run a social enterprise, last mile distribution. And so I'll quickly say what we're about. Essentially, we've been developing a new mission to end the darkness. And what that means is by the end of this decade, we believe no one in Africa should be left in the dark. And specifically, that means no home, no school, and no clinic. And so we've been operating since 2006 and always looking at how we can best achieve energy access. And we've always been trying to prioritize the people who are least likely to be reached. So obviously we've been working through Sunny Money, this social enterprise, to try and catalyze markets. We've done that quite successfully over the years, and we see it as a huge success that the likes of Gogler and many last mile distributors now exist, and small solar is becoming far more of the norm. But what we now do is look at, well, what's the gap? What are the limits of what a market is able to actually serve? And we do that at household level and what we're innovating there. But then also for this, it's actually about the clinics. Now we have installed systems on clinics in the past. It was a lot of work. They needed solar technicians. They were quite expensive. And we were always scratching our heads as to how we could keep them operating. It was quite expensive. So we actually stopped doing that work about 10 years ago. Last year, we started looking at, well, how can we look at plug and play solar systems? So I was excited to see d.light on this call. How can we use plug and play solar systems which are DC, they don't use inverters, so they're far lower cost, and how can we pair them with energy efficient medical appliances? So we were doing all of this work when then COVID-19 hit. And so very quickly we paused all of our activity and said, what can we do now? And so we spoke to the medical, the health authorities in Malawi and Zambia. We looked at our stocks that we had in country already. And, being a distributor, we had solar lights, we had solar home systems, and we spoke to them and said, how can we help? And we quickly realized that we could quickly equip the quickly assembled isolation sites in both countries with basic power and lighting. The health surveillance assistants, they're sort of the health workers who go beyond the facilities and provide basic care in rural areas, and also in health facilities themselves. So we distributed 4,450 solar products in April and May, just to be ready, because none of us knew how, and we still don't really know how hard this is going to hit a lot of these countries. So that's what we've done. And now back to what I was talking about. So next slide, please. And this is what we're doing. And so basically it's back to, right, we were looking at plug and play home systems. So we were looking at d.light, we were looking at, Green Light Planet due to the Sun King range. And then also looking at and learning from the likes of We Care Solar, who we love, and looking at the kind of medical appliances that could be powered by these. And the rule of thumb we've been looking at, because we do look at small levels of power to have high impact, is if an appliance can be powered with a AA battery or a AAA battery, then it can generally be powered by plug and play solar. And so, that's pulse oximeters, infrared thermometers, fetal Dopplers, of course, phones, radios, etc. And what we're trying to do, and we're kickstarting a pilot in Zambia right now, is equipping these, including GSM, so we can monitor the energy use, etc., and learn, and then develop a financial model. The rule of thumb is, it's already been said by other people on this today, is basically plug and play solar has a role to play. It's low cost. That means that you can develop a financial model a little bit more easily than with the larger systems. It's not going to replace larger systems, but what it can do is be rapidly deployed. And there's a lot of last mile distributors across the continent, including d.light, including all the lots who are not on this call, who could actually quite quickly start serving rural health facilities. Now, it's not the full solution, but it's the basic solution. I've got 30 seconds left, so what should I say? I'll say thank you. We're excited, we're learning. We do feel that we're a little bit outside our comfort zone. We are talking as much as we can to medical providers, and we're really thankful that SEforALL and has set up these sort of platforms. Thank you.
Thanks so much, John. I took note when you said, what can we do now? And that is such an important question that a lot of organizations have asked themselves or started asking themselves a few months ago when this pandemic really started to grow and is still growing and is still hitting many countries who are resource constrained, who are struggling also in terms of energy access as well as access to healthcare. So thank you so much for bringing that up and for showing what SolarAid is doing, not as a manufacturer, but just as an NGO that's on the ground and that actually has access to deploying many of these solutions that manufacturers are developing. Great, thank you so much. Next up, we have Kjetil from Differ Group, who's going to bring us back to slightly larger solutions, but very curious to learn what Differ Group has in store for us. Kjetil, go ahead.
Yes, thank you very much, Luke, and thank you for the opportunity to present here today. Differ is an expert within distributed energy with lots of experience in markets, technology, financing, and importantly also experience on doing installations on the ground. What I would like to talk to you about today is what we do towards community buildings and towards health facilities in particular. We have turnkey solutions that are in a way available and ready for implementation as of now, and these are turnkey solutions of any size, ranging from DC systems below 1 kilowatt-hour battery capacity and up to 100 kilowatt-hour lithium battery capacity AC. As you can see from the first slide here, I emphasize the word sustainable. I will say that this term, of course, it captures quite a bit, but it's clearly about solar and renewable energy, but the term sustainable is also about the fact that it shall be durable, it shall be lasting, not only a year after installation and commissioning, but also 10 years after installation and commissioning. So the O&M element of this is quite important to us. Next slide, please. So what you can see here is that we provide solutions that could both go completely off-grid, but it could also be on-grid, meaning connecting to existing and in many cases unreliable grid, as well as diesel generators. The key point here is that once you invest in this kind of technology, you should use it as much as possible. So it should be the primary source of electricity, meaning that you should only use the grid and diesel generator whenever it's needed. That's one important point. The other point I would make out of this slide is that is the unit itself, which is in well, it's a big solar home system. It is pre-wired, pre-connected, containing everything that is needed: batteries, inverters, MPPTs, control systems, switches and fuses, and everything. And it's PEGO ready, and as I said, also AC/DC systems, meaning that these are bankable units that easily can be scaled up in large volumes. And next slide, please. The fact that we are a one-stop shop with integrated energy solutions for health facilities and goes beyond the core unit that I showed on the previous slide. Of course, it includes generation and storage capacity, but also appliances, which means both medical and non-medical devices. That is key. We also provide project development, EPC services, site assessments, training of local technical partners for installation and commissioning. And then we have schemes for operation and preventive maintenance, so that it ensures sustainability throughout the year. So in total, we could say that we take the total responsibility for the service delivery from A to Z. This has been implemented in many countries already, and we are ready to do more. Thanks a lot.
Thanks so much, Ketil. We're almost there. We have 2 more to go. Yeah, I think most of you on the call here know Dr. Laura Stachel at WeCare Solar, but it's definitely a type of solution that we feel is one that can be deployed rapidly, that really fills a certain part in the market. So curious to learn more about WeCare Solar and about the solar suitcase. Laura, go ahead.
Okay, thank you, Luke. Let me just get my video on. So I'm actually coming at this from the medical space. I'm a physician myself, obstetrician training. Next slide. And what we were really interested in doing 10 years ago. Next slide, please. Luke, are you able? Oh, great. So go back one. I hope I get a few more seconds, Luke.
You will.
What we were really interested in doing, but you need to go back, right? So what we were really interested in doing was understanding, what was really affecting the loss of life in childbirth. There's 300,000 women and more than 1 million newborns who die every single year from complications of pregnancy and childbirth. And as an obstetrician, I went to try and study the issue back about 10 years ago and really try and understand what are the factors. And certainly electricity was a huge factor that was contributing to this from my research, contributing to suboptimal care, delays in care, canceled procedures, as well as safety concerns of using fossil fuel sources of light. The other thing we're seeing is that people are using cell phones in their mouth as a way to hold a light beam while they're doing deliveries to keep their hands free, and that's increasing risks of infection, as well as the risk of infection just not being able to see things. So all of these things have contributed to loss of life. We were really interested in trying to think about a scalable solution that would both be providing energy generation as well as providing the loads that would be most critical for saving lives. And so we developed something called a solar suitcase, which is a compact, rugged, reliable, institutional grade solar electric system. So this system is actually something that has been designed with the highest quality in mind. The lights themselves last 70,000 hours and have been designed to be good enough to do cesarean sections in an operating theater. They also can be adjusted so that if someone is having a hemorrhaging patient, the light can be placed exactly where it's needed. They also include end appliances, such as a fetal Doppler, which is used to monitor a baby's heartbeat. We now, for COVID, have started including infrared thermometers, both rechargeable batteries, as John Keane was mentioning. And there also are ways to charge cell phones as well as other devices. We also include 2 LED headlamps that can be used to augment the 4 to 6 lights that come with the solar suitcase. They include a 5-year battery. They've been really designed so that they are very low maintenance and very high efficient and rugged. We have now served more than 5 million people, and we've seen from follow-up research that even a compact system can be life-saving. They've been connected to improved quality of care, improvements in emergency communications so that emergency teams can be assembled or ambulances can be called. The fetal heart rate monitoring has led to decreases in newborn mortality, and we see better infection control in the health facilities using these things. And this has been documented both in qualitative research, randomized controlled trials, as well as larger comprehensive multi-intervention studies. Next slide. Next slide, please. We work at the systems level, working with governments and an array of partners. And through our programs, we have reached more than 5,200 health facilities. We also build local capacity so that we train people both to installations and maintenance, as well as how to use the equipment effectively. Through our programs, we have reached, as I said, more than 5.8 million mothers and babies, predominantly in Africa, but we've also done some programs in Southeast Asia. And the countries that are golder in color are our Light Every Birth countries. This is where we're doing countrywide programs. Next slide. The countrywide initiative is called Light Every Birth. Light Every Birth is an initiative where we're working in partnership with countries to ensure that every health center has reliable light and energy for safe childbirth. And we're working at multiple levels. We're doing innovation at scale, meaning that we're working on human-centered design. And we've just released our newest version of the solar suitcase, which has many improved features, including the capacity for remote monitoring, as well as different light settings for different medical procedures and a larger battery for better storage. We do manufacture and we also work on logistics. As far as building capacity, we now have regional office in Africa and offices actually in 4 countries. We have memorandums of understanding with multiple governments that are based in countries with very high rates of maternal mortality. We have a training program to build certified trainings, and that's actually promoting women as solar installers. And we do a lot of advocacy work similar to Light Every Birth, to SEforALL. And at the programs level, we work to really document which health facilities are in need, to provide installations that will last a long time with quality assurance monitors that will check to see these things are working well, and to train health workers to use all of the appliances inside. We have sustainability plans that we have been developing with governments, and we are training district health technicians throughout countries to ensure that they will be people locally that understand how to use and maintain our systems. And finally, research is a big part of what we continue to do. We are going to be publishing several papers this year showing the impact of our work through a randomized control trial led by Harvard, as well as papers that have been done by our own team. Last slide. We are really hoping that all of you on this call, on this panel, next slide, will be part of our Light Every Birth initiative, which basically is saying that every woman deserves a safe delivery, every health center should be equipped with reliable light and power, and that solar energy is a very immediate and sustainable solution to this problem. And all of you I see as Light Every Birth partners that are working to save this. And one thing I will just say is that during COVID, one of the very big concerns is that there's going to be a dismantling of some of the essential services in healthcare. And so attending to the whole range of services at the time that COVID is being attended to, I think it is really, really important for us to really uplift healthcare and try and work towards universal healthcare for all. Thanks.
Thanks so much, Laura. And I think, yeah, you ended on a very, very important message to show that the energy sector shouldn't work in silo, the health sector shouldn't work in silo. None of these solutions providers should work in silo. This really needs a concerted and a coordinated effort to really tackle this problem once and for all. So thank you for those encouraging words and for reaching out also from the health angle to the energy community. Much appreciated. We're going into our last pitch now. So I'd like to invite Mariana to unmute herself. Mariana works at SEmu Solar, and I'm personally very excited to have SEmu Solar on the webinar today, because it's the only intervention that is not just talking about the electricity side on the medical appliance side. It's actually talking about a different part that equally impacts quality healthcare, which is access to clean water, which is a very similar and a very linked barrier that a lot of these health facilities are facing. The access rates to electricity and to clean water, they're very, very similar for reasons that you'll all understand. But so I'm very, very curious to hear about the solutions that SEmu Solar wants to present. Marianne, your 5 minutes start now.
Thank you very much, Luke. It's a pleasure to be here. I'd like to introduce myself. I'm Marianne Walpert, co-founder and co-CEO of SEmu Solar. I've been working in Tanzania for over 13 years now. With my former organization, I installed many lighting packages at rural clinics in northern Tanzania, including some of the WeCare solar lighting packages. And I think that everyone on this call is very familiar with the conditions of the rural healthcare clinics in East Africa. So in 2014, I founded SEforALL. SEforALL is in the business of providing financed, standalone, solar-powered productive use equipment throughout Tanzania and Uganda. Our focus is agriculture, and our primary product line is solar water pumps for smallholders. We have 8 offices in 8 regions and are serving most of Tanzania, and last year we began our operations in Uganda. We are a last mile distributor providing custom system design, financing, installation, and after sales service. When we started dealing with COVID-19 in Dar es Salaam and everyone was putting up hand washing stations around the city, I couldn't help but reflect on the conditions in the rural healthcare facilities. And it's true that they have no electricity, but perhaps even more impactful, especially right now, is the fact that they have no water for most of the year. So sanitation is something that we take for granted as being critical in healthcare. Again, especially now with the emphasis on hand washing and cleanliness for the prevention of COVID-19. So SEforALL is offering an equipment package for the clinics, including the solar panels, solar water pumps, hand washing stations, and a lighting package, and additional power for charging and other small appliances. The water pumping systems are not a one-size-fits-all product. The type of pump depends critically on the source of water and the amount of water required. So SEforALL has developed apps so that our staff can quickly design the appropriate system on site, specifying the correct pump and the number of solar panels required. We carry 15 different pumps, and we are a for-profit organization, so we're very efficient in our operations. The hand washing station is locally made using locally available materials, and it's operated by a foot pedal for sanitary operation. The lighting and charging station is significantly bigger than some of the standalone packages with a 70-watt panel and 250 watt-hour battery. So it's sufficient for running the 6 lights all night, plus a number of other appliances that can be charged using the charging station. Currently in inventory, we actually were quite lucky. We had a lot of inventory when COVID did hit. So we have over 250 pumps and panels to power them, as well as the We've been doing quite a bit of work coordinating with the local governments and the national governments in both Tanzania and Uganda, and have received a list of 200 sites specifically that have no water and no power that would be the highest priority sites for the local government officials in those countries. In 200 in Tanzania, 100 in Uganda. Next slide, please. We also have a couple of options to add on to these systems. People are often talking about the sustainability of these projects. I mean, one of the problems is you spend money, you put a system out there, and then after some period of time, it's not working anymore. So one of the options we're particularly excited about especially for the clinics, is the Smart Tap, which is basically it's a pay-as-you-go water dispenser. And what that does is it does 2 things for the community. It offers water, safe, clean water that's easily accessible for a very nominal fee to community members. And it also provides a stream of income for the healthcare center so that they then have money for ongoing operation and maintenance and upgrading of the system. So that really does answer the sustainability problem, I think. And it's something where it fits right in with the work that we're already doing with financing, with mobile money payments, as well as a refrigerator. It's quite cost effective to add a refrigerator at the time that you're doing this. So working with the community, planning and mobilizing for an installation at these rural sites is a significant investment. So we believe that it's quite a bit more efficient to install the full set of equipment that's needed by these rural clinics so they can safely provide services to their communities. Thank you very much.
Thank you so much, Marianne, and thank you everyone for, first of all, for sticking to the time. Absolutely, I'm very, very pleased with that. I'm very pleased with how we were able to pack so much information into into just an hour. We'll move on to the catalog in a second, but before we do that, again, just encouraging the audience to use the Q&A, take advantage of having these 8 experts here on the line, and to the experts, feel free to pick and choose some questions, respond to them directly into the Q&A, because I see some questions are coming in already, some are being answered, so we're very pleased to see that. On to the next part of the agenda, which is the Powering Healthcare Solutions catalog. Next slide, please. I'm now pleased to invite my colleague Jem Porcaro and close colleague Rahul Srinivasan from the World Bank to unmute themselves and to shed a little bit of light about what this Powering Healthcare Solutions catalog is and the purpose of it, because I've been mentioning it multiple times, but I actually haven't revealed what it actually contains. So Jem, perhaps you want to kick us off?
Thanks, Luke, and thanks to everyone for sharing your story, for sharing information about the various solutions that you're offering this really critical and important challenge. So, as Luke mentioned, in an effort to make sure that we capture as many of these various solutions and solution providers, in partnership with the World Bank, we are launching or publishing a digital catalog of powering healthcare solutions that is available on Sustainable Energy for All's website, and the link is provided below. That captures all of the solutions that were actually featured today in the webinar, as well as about 7 or 8 more. Various technologies and solutions for meeting the energy needs of healthcare facilities on the front lines of COVID and beyond. And I think, as Luke mentioned, the idea here is that we, together with our partners at the World Bank, plan on regularly updating this catalog as additional solutions and companies raise their hand to offer up their solutions to the catalog. And really kind of, this is meant to be a kind of a running repository of solutions that we really think and we're trying to promote to governments and donors who might be interested in, who are, planning to invest in strengthening health systems and making them more resilient. And the idea is to raise awareness around a lot of the new innovative technologies that are available on the market that are being provided by the kind of companies and organizations featured today that may not be known to some of the key decision makers who are designing such programs at the national level. So we've made a concerted effort to really promote this catalog, and we'll continue to do so, particularly focusing on government decision makers, policy makers, donors, and their development partners. If you visit the catalog, you'll see that it's a very simple layout. Every solution or solution provider has one page that contains additional information about their company, their particular technology, some technical specification, which geographies these solution providers are active in, are able to deploy solutions in, some indicative lead times so that folks understand how quickly and rapidly some of these solutions can be deployed, as well as, importantly, what sort of needs do these companies have? Are they looking for partners? Are they looking for grant financing, equity, debt, etc.? And again, the whole idea is that with the contact information that's provided for each one of these companies, this is a bit of a matchmaking effort and investment on our part to make sure that we try to match up supply and demand. Let me see if there's anything else that and I would just say that this is one of a number of efforts that we're trying to make here at SEforAll around kind of broader matchmaking, connecting both the energy and health sectors, raising awareness around a lot of the innovation that's been happening both on the technology side as well as the business model side and on the appliance side, within the off-grid sector, to, again, principally those organizations, governments, decision makers who are designing health system strengthening programs or rural electrification programs to ensure that the most best-in-class, most rapidly available, kind of the most available technologies are brought to bear to help address some of these solutions. So again, I encourage all of you to please visit the website, the catalog. As I said, we will regularly be updating it. And for those organizations, we encourage anyone who has a solution, who would like to have their solution featured in the catalog, to please contact us. We will be adding to the catalog in the days and weeks and months to come. I think with that, I'm going to hand it over to Rahul from the World Bank, who we've been working quite closely with in the development of the catalog. Over to you, Rahul.
Thank you, Jem. Thank you, Luke. Can you hear me?
Loud and clear, yes.
Yeah, thank you, Jem. Thank you, Luke. And thank you to everyone who's joined this very important webinar. I think as Jem mentioned, for both the World Bank and SEforAll, our engagement with the electrification of health institutions and providing energy solutions for healthcare has predated COVID-19. This is something that we've been working for a number of years. And it's just that during COVID-19, a lot of this work has very rightly gained a lot of traction and has become more relevant than ever. So of course, we are very, very invested in continuing to deliver our services, deliver our responses to assist governments and countries to fight the COVID-19 pandemic. But I think what is also very important is how are we looking at SDG 7? How are we looking at attaining electrification of all the health facilities in sub-Saharan Africa and other developing countries by 2030? And not only attaining electrification, but also doing that sustainably. And when I say sustainable electrification, well, we're looking at how these solar systems can be operated and maintained over the lifetime of the solar assets, and how we are able to bring in accountability in terms of payment for these services. Whether it's government agencies, whether it's donors, whether it's other partners, how are we able to deliver a coordinated response where payments are being made to the private sector to deliver services over a period of time? So I think I would once again want to emphasize that our engagement predated COVID-19 and would continue after COVID-19, because both SEforAll and the World Bank are invested in electrifying health centers and providing energy services for healthcare in line with SDG 7 and SDG 3. In terms of this catalog, I think, again, it's a great platform. In my opinion, it's in many ways a way to democratize access to information for big private sector companies. Could be medium-scale private sector companies, small-scale private sector companies, doesn't matter. If there is an innovative and quickly deployable solution, that you have, I think you can easily be connected to various stakeholders from the development community. All the catalog would have information from not only the 8 presentations that are being made today, but everyone else who has a track record in providing energy solutions for healthcare is more than welcome to send information to both me and Luke. Our email addresses are provided in the announcement and the poster that came with this webinar. So we encourage you to send us your information to basically tell us that you're interested, and then we would send you a questionnaire to fill that can eventually be integrated in this catalog. As Jem mentioned, the idea is to regularly update this catalog so that donors, multilateral agencies, NGOs, every stakeholder in this space can access information from private sector providers who are in this space. So we're really excited to co-launch this catalog with SEforAll, and we want to continue working with SEforAll in this space. As I mentioned, use this catalog not only during COVID-19, but also in the long term to make sure that we are delivering what we promised for SDG 7 and SDG 3. I think the last thing I would like to share is that according to our estimates, according to World Bank estimates, billions of dollars will be needed up to 2030 to electrify all the remaining healthcare facilities, both in sub-Saharan Africa and other needy countries. And I think it's very clear to us that just one donor or one multilateral agency would not be able to deliver this response, would not be able to mobilize these billions of dollars that are needed. We need the private sector to step up. We need all the stakeholders to step up, to mobilize financing, to make sure that our efforts are sustainable. Because it's just not done if we provide financing for a system and it breaks down in a few months and then another system is needed. I think we want to make sure that whatever we provide, it stands the test of time, and especially until the lifetime of the system, right? And that would really help us make our efforts sustainable and help us meet SDG 7 and SDG 3 up to 2030. So I'll stop there. Again, looking forward to collaborating with various private sector companies and obtaining the information and making sure that their products are accessible to the broader international development community. Thank you. Over to you, Luke.
Thanks, Rahul. Thanks, Jem. We've been working closely with Rahul and his colleagues to develop this for the last couple of weeks. So of course, we're no longer objective. We're very biased, and we see the value of this product. So we thought that it would be a good time to also just test that and get an external perspective from one of the energy access leaders in this space, namely Shell Foundation. So I'm pleased to invite Ashish Kumar from Shell Foundation for his reflections on what we've learned today, both the catalog, some of the solutions that were presented, as well as Shell Foundation's approach to this topic. Ashish?
Great, thank you, Luke. Can you hear me okay?
Loud and clear.
Can you see me?
Yes, loud and clear. Perfect, thank you.
Awesome. So super excited to be on this webinar panel, and great to see the presentations from a number of private sector innovators, which we have known well and been working for over the years. And from a foundation perspective, as you guys know, like we have always been championing a market-based solution, and we have always wanted to sort of help them scale in a commercially viable way. Along with working with the public sector and other donors. So in that regard, very excited to see this catalog coming together, as well as the innovators out there. I think in terms of like what we covered today, obviously the time was limited, so we couldn't, other than the technology and the features, as well as how they are adapting to the needs of the need of the hour in terms of COVID response, we couldn't cover much of a lot of the commercial aspect of it. How can they be funded? What models could be there, be it like, pay as you go, or sort of long-term leasing, or, even PPAs in the larger system context. So that would be good to cover in the coming time. But as a one-stop shop of these, solutions in a catalog will be powerful for donors like us as well, to see where, what systems are there, and how, in terms of the financing need, what role can a donor along with the commercial funders can play. I would like to highlight some of the work that we have been doing, where which is kind of complementing to it, and which will also help extend the work that that has just been being launched today in terms of catalog. Sorry, I'm hearing some echo. We have been working with, along with Rockefeller Foundation and my colleague Emma Miller here at Shell Foundation, in terms of a software platform, Odyssey Energy Solutions, which helps a number of, it's a marketplace, as well as a way for the investors and the project developers to build their project and do long-term, asset monitoring and tracking. And with them, we have developed, a powering health platform to allow for any either mini grid developers or even solar home system paygo providers to be able to do 2-3 things. One is building a pipeline of sites where they can actually deploy, these the sites for PHCs and health clinics and hospitals at primary, secondary, tertiary level, which is data driven, working along with some of the leading data providers in the sector. Secondly, on aggregated procurement, which will help do a bit of inventory management and take care of the inventory, collated inventory needs if you are thinking about bulk procurement for a number of sites together. And thirdly, and most importantly, I think the long-term sustainability is very crucial. So, for a number of presenters today, I would have been very curious to see in terms of financing, is it like the upfront capex being provided by some of the programs that are being designed by the multilaterals, donor-led? Then what happens to the long-term O&M, which is necessary as well for them not to avoid the risk of them becoming stranded assets in the long term. So we're trying to work with Odyssey to make sure the financing is taken care on one side, as well as the asset monitoring and tracking, asset management can be done so that you have the right set of data to convince any private sector funder to also look at that particular area. So I think it's a good stepping stone in terms of having this aggregated catalog, and we are hoping from a donor perspective to coordinate more closely, as Jem mentioned, with the health community, with the likes of WHO and Gavi's of the world to ensure that it's totally integrated approach. Thank you. I hope that covers some of the thinking from our side, which could be helpful to take this work forward.
Thanks, Ashish, and yeah, very helpful, and just it's a good validation to get these reflections from Shell Foundation, and to clearly highlight the value of these types of tools and resources that we are constantly developing and updating to broker these connections and to turn this increased momentum that we're witnessing into some tangible action, and to actively remove the barriers that we know still exist that are holding up wide scale deployment of solutions, of energy solutions to health facilities. I feel like this is maybe the first webinar of all time that is actually running ahead of schedule, so that makes me very happy. We have seen different types of solutions today, solutions that clearly showcase the role of the private sector, the role of civil society and NGOs, the role of donors as well, of investors. Government agencies clearly also are our key target audience, need to be made aware of all the solutions that exist. It also clearly shows that both the energy and the health sector need to come together to fix this problem, to address this problem. But today I feel also shows the richness of solutions that are available to address all these different problems that may exist, that may be very context specific, be them at the micro level or at the macro level, but especially solutions that can be deployed rapidly. I think that's always been a key criteria of what we wanted to convey today. And so we hope that all of you, both in the audience as well as the speakers, that you will be actively take part in turning this increased momentum that we are witnessing into real and tangible action. So with that, I'll ask my colleague to move us to the last slide. And with that, I'll just close this webinar by saying that there are still thousands of clinics that are either unelectrified, under-electrified, unreliably electrified. As Rahul mentioned, it will take billions to close this gap, but it can be done. It can be done if we get it right. It can be done if everyone asks the John Keane question, what can we do now? So we at SEforAll, we will continue to work with partners, with all of you, as part of our Powering Healthcare program to advance this agenda, to aim for global, sustainable electrification of all health facilities by 2030 or sooner, hopefully. Please do not hesitate to reach out to us. please go to our website, go through the solutions catalog, let us know your feedback, send us your other solutions that you feel could be really well positioned as part of the catalog. We're really keen to keep on updating this. So keep us busy and keep those solutions coming, because we know that what we're currently presenting, it's only a subset, it's only a sample of all these different types of solutions that are out there that can actively meet the energy needs of health facilities, both as a response to COVID-19 as well as beyond. So with that, I'll now formally close this webinar. Please stay safe. And on behalf of SEforAll, we thank all our speakers for presenting their solutions. We thank all of you for joining us. We'll keep this webinar up and running for another minute or so to allow all of you to slowly ask your last question in the Q&A or respond one or two. But other than that, we thank you for joining us.